What would you say was an unexpected challenge that you faced in developing Lenire in the early stages, and how did you have to overcome it?
In the early stages, I mean, there's so many challenges. Like every challenge you face, you think, if I just get past this one, the next it'll be easy, plain sailing after this, and it never is, right?
Yeah.
I think probably the biggest challenge we faced was the FDA. Obviously it's the highest bar in terms of bringing a new product to the market. So we had to do a clinical trial. So we had kind of interacted with them. We'd shown them our data from Tenty 1, Tenty 2, and we agreed on a design for a controlled trial. It was this single arm repeated measure study where we gave the patient sound therapy first, and then we followed up with bimodal to show that bimodal actually outperformed sound therapy, which it did. We got approval on that basis. Getting that trial up and running was quite challenging. We had to do it. It was a 3 clinical site trial across 3 separate countries. We were doing it in COVID. As I think I've said to you before, we did it in 9 months pretty much, but that is down to the motivation of the tinnitus patients. So tinnitus patients are, like, honestly, they're the best patients in the world, because they're highly motivated, they really want treatment. And so if you give them a treatment, they will comply. If you recruit for a clinical trial, they will turn up in huge numbers, and they'll complete the trial. We always have fairly low dropout rates, so they're fantastic patients from that perspective. So, and it was that allowed us. Recruitment is one of the parts that slow down clinical trials. But we have never had a problem with recruiting. Actually, we have the opposite problem. That when we advertise, for our first clinical trial, we learned that very quickly. We advertised for 2 weeks, the ad that you saw.
Yeah. And
7,500 people responded to those ads. 7,500 people registered for the trial. That's in Ireland. It was pretty small. It's a pretty small country, right? 4.5 million people. And it's, so it's that can be a challenge, the volume of patients that come. But yeah, look, they're all good challenges, if you like,
Yeah, you learn something from everything.
Every challenge you overcome, you learn something.
And I think even as a clinical provider, utilizing Lenire in the clinic, how we talked about it, how I explained it, what my expectations were, have changed in the past year and a half, right? Yeah. And so I think back, right, or in the early stages of me being able to offer it, and things that I said or kind of how I frame things are different than I do it now. And hindsight's always 20/20, right? You're always going to learn and grow. Yeah. But the confidence that I've seen based on patient outcomes outweighs every challenge.
Yeah, and I think I've said it to you before. What we're seeing now with the real world data is it's actually better than the clinical trial data, and we're putting that down to what we call the 3 Ps. So when you put a highly effective product in the hands of expert providers like yourself who follow well-defined clinical processes, you get exceptional results. So that's why we're getting I would say improvement in terms of percentage responders, 80, in some cases over 90s. So Emily's clinic in Alaska are getting over 90% response rates. Craig Casper in New York is getting kind of 80s. Brian Flygore in Boston over 80 as well, and then average improvements that are multiples of the clinically important difference. So it's that combination of, it's not just product, it's provider skill as well, and when you get that kind of recipe right, then, as I said, you get exceptional results.
Absolutely.